A good rule of thumb is be extremely aggressive, preventing metabolic syndrome, and to do almost anything that you can do possibly while discussing it with your healthcare provider to prevent diabetes. Risk of heart attack in postmenopausal female, lower on HRT. There was an interesting study, fairly recent I believe, on specifically hypogonadal men. And if you intervene with, to improve their testosterone, I believe they used TRT on all the individuals. They have a lower incidence, and I don't know how many years they went out, but they followed them out, or perhaps it was a retrospective cohort, and they have a lower incidence of heart attack, even despite having higher LDL, possibly partly due to LPA, partly due to estrogen, and maybe partly due to HDL as well.
Yeah, and we can't overlook the insulin sensitivity component of that. And we know testosterone does promote lean body mass. So if you take a hypogonadal individual, they're going to put on lean body mass. They're going to lose body fat. If you DEXA scan them, beginning of the year, the end of the year, you're going to see those differences. Now, I'm sure there's exceptions to the rule. If you can be very sedentary, I'm sure you could not put on muscle and not lose body fat, because there's always outliers. But in general, that's one of the effects we see. And something that we see also is people who used to be in really good shape, they were exercising a lot, maybe they were a college athlete perhaps, and then they continue to eat like an athlete when they transition into their professional life, usually where they're more sedentary. So something that I'll occasionally say to people is if you're going to eat like an athlete, meaning consuming a high number of calories, you're going to have to train like an athlete. Otherwise, the weight is going to go in the wrong direction. You're going to get some visceral adiposity that's going to promote all the things we don't want to see: inflammation, insulin resistance, and so forth.
A good rule of thumb is be extremely aggressive, preventing metabolic syndrome, and to do almost anything that you can do possibly while discussing it with your healthcare provider to prevent diabetes. Because if you prevent diabetes, which is essentially just very severe metabolic syndrome, all of these other things that we've talked about, the dyslipidemia, the insulin resistance, the inflammation, the low metabolism, the sleep apnea, the hypertension, the renal disease, all of those things will improve.
Yeah, would it be fair to say that people should exercise like their life depends on it?
Pretty much. Exercise is like everything else. You use it or you lose it. So, health is like that too. People kind of understand this from a career basis. If you retire, let's say you retire at 60 and then try to come back at like 68 or 70, it could be particularly difficult. But if you work through 68, a lot of times just that consistent habit keeps your cognitive fitness high, at least for that specific task or job. And you could say the exact same thing when it comes to exercise.
Yeah, absolutely. And a lot of the decline that we see in, let's say, individuals 75 plus, where their VO2 max and lean body mass goes down, a lot of that's not because, of course, it's going to be partially due to tissue changes with aging and system decline, but also there's a lower level of exercise. And you can see people who maintain very high levels of fitness, high levels of lean body mass, and even good testosterone production into their 70s and 80s if they are doing all the right things and really putting that first and foremost in their life.
Yep.